Hi, welcome back to Rohrich Knows, helping you become a better, more informed you. Today we have one of the world experts in breast surgery, and guess what we're going to talk about? The biggest challenges in cosmetic breast surgery today. It's Dr. Bill Adams, the founder of the Plastic Surgery Channel, where we tape every week on this podcast and YouTube channel. So Bill, welcome. Welcome to.
Thanks for having me, Rod.
It's good. So what is the biggest challenge in breast surgery today, would you say, globally?
You know, I think it's largely misinformation on the internet and social media, because that's where patients get terrible information. They think it's reality. They see things. Who knows if the pictures are, you know, what kind of Photoshop pictures they're looking at. And that, so what's happened over the past 20 years is that the educational component for all of breast surgery has become the not only the most important part, but the hardest part.
And it's become like blowing up in social media. A lot of misinformation, not education, right?
Yeah. And so, you know, when we see patients, I have actually a dedicated patient educator who's incredible, and she talks to every patient with a dedicated patient education consult before I ever do my surgeon consult, you know, and that's unique because most other areas of plastic surgery, you don't have that. There's so much internet and social media bias and misinformation and then you throw other controversial devices in there like breast implants, you know. So it's a tough deal. So education has become really important and essential for people to get optimal outcomes.
Yep. No, I agree. I mean, there's so much misinformation. No, above, below the muscle, implants are bad. All of them need to be removed with muscle. It's just crazy stuff. I mean, you know, unless you're even in the medical field, even people in the medical field are confused. Yeah. I mean, I agree. I mean, so I mean, the basic question is, are breast implants safe? And the answer is?
Yeah, absolutely. And you know, again, and it's been this rebirth on social media.
Right.
You know, everybody's entitled to their own opinion, absolutely, but people are not entitled to their own facts. And so the science, again, there's been, you know, it's a little bit of history repeating itself, right? Because we went through this in the 90s.
In the 90s.
And again, then there wasn't actually that much science, but there was quite a bit of studies done, and largely all those concerns were put to rest. And then more recently, there's been more stuff that's come up on social media. But there's even more science now than there was a year ago, and certainly a lot more than there was 5 or 6 years ago. And the science just doesn't support, you know, anything beyond the typical local risks and things like that we know, like bleeding, infection, other things like that.
Right.
But in terms of health issues and things like that have been, you know,
surmised,
put out there on social media, it's just not supported by the true science.
Yeah. No, I agree, and I think the breast implant is the most studied implant that's placed in the human body by far. And you're right. In the 90s, you know, there was a lot of anecdotes, but now we have incredible level 1, level 2 science on safety, outcomes. It's actually been amazing. And you know, we were propelled to do that because of the lack of science. But today, it's the most studied implant. So where do we go from here, Bill, on breast implants and how we interact? I mean, you've obviously been a leader in not only safety, but also in how to place them and how to put them in to have them last longer, dispelling some of the myths that they only last 10 years. You want to tell me about that?
Yeah. So certainly the breast implant technology has definitely evolved in a positive way, and I think that's been a good thing. But at the end of the day, it's far more important for the person using the device than what the device is. So, you know, I think like largely all of the breast implants, the more modern breast implants that we have now are good devices. And you can get, if you're a good surgeon and know what you're doing, and you know, you go through what we call, you know, say the process of breast augmentation, or do the things that you need to do, you can get a really good result with any of these implants.
Right.
So no device solves poor decision making, poor surgery technique. Those are all the most important thing. Interestingly, as you mentioned, the longevity of the implants. So it used to be this is the older generation implants, the generation 2 implants, which are actually very thin shelled, thin, less cohesive gel implants. They had basically by 10 years, they were all leaking or ruptured. Right. And so that's where the notion that implants need to be replaced every 10 years. And that's still stuff that comes up with the FDA. They're not lifetime devices. But the truth is that we just published an ultrasound study, because now we're doing implant surveillance with ultrasound, which is in-office ultrasound, which is phenomenal, and patients love it. Actually, as you know, it was the original recommendation from the FDA when the implants were approved in 2006 is that patients needed to get an MRI at 3 years and then every other year after that. And unfortunately, we at the clinical advisory meetings, the one in 2000, there was one in 2013. There's another one in 2019. But at these advisory clinical or FDA advisory meetings, we kept presenting patients are not doing MRIs. They don't want to do it. They're not going to do it. Right. Ultrasound is a far better tool. And so finally in 2019, ultrasound was recognized as an option for surveillance. And so in our study that we just published in ASJ, we found that basically at 15 to 20 years, only about 10% of the current generation implants, and that includes the ones that were produced or approved in 2006, only about 10% have any kind of tear in the shell or leak or rupture. So what I tell patients is look, you may have to replace your implant at some point, but they don't need to be replaced every 10 years. In fact, they're probably going to last longer than that. You should do we recommend people do an ultrasound every 5 years. Yeah. And that's a great way to do surveillance. And it's easy for the patient. They come in there, they come into your office, they're in a familiar place. They don't have to wait a long time. They just do the ultrasound and they know what the status of the implant is.
And what about today, Bill, women still age 40 get a mammogram, and then we also, in many states, including Texas, it's required that if they request it, they get a high resolution ultrasound, which is very accurate, right, as well?
Yeah. It's extremely accurate.
Yeah,
yes.
so that's what I tell my patients, because I see patients all the time where their family doctor said, oh yeah, you need to see your plastic surgeon, it's 10 years. And you said, you had an ultrasound and a mammogram. They both said they were fine. I said, you're fine. Yeah. So how do we get that message out there that, when they're getting their mammogram, I always tell my patients, get a high resolution ultrasound with it. Yeah. You should, because it's actually better for high density breasts.
Yeah. It's interesting technology, and that's actually evolving. There's even some technology out there that almost does the same thing as mammograms. Ultrasound, like when we're doing ultrasound in the office, we're looking just at the implant and the surveillance of the implant, but looking at things like microcalcifications. There's some technology now that can see those things with high resolution ultrasound
with the mammogram.
And that's evolving. That it's maybe at some point people would be able to do this more advanced ultrasound technology, say in lieu of a mammogram, because the one thing of the mammograms, and actually this is why I think the American Cancer Society has changed the guidelines. They're actually going less frequent mammograms, because what they're finding is people are getting a radiation dose, and over time it's building up. So, there's a lot of changing recommendations, but I think in the next 5 to 10 years there may be a non-radiation sourced ultrasound or something other that women will be able to do for breast implant, or not breast implant, or maybe both, breast tissue surveillance, and certainly, even current in-office high-resolution ultrasound is excellent for breast implant surveillance.
Great information. So, Bill, so in capping, what are the 3 take-home messages you want the viewer to know about breast surgery today, where it's come from, where it's going?
Yeah, I think that don't believe everything you see on social media or the internet. Information is great, but misinformation sometimes is worse. And so you have to take things in context. I think it's a good start, but then you need to find an expert in breast surgery. And just because people are plastic surgeons, not everybody does a lot of breast surgery. So you really need to research that a little bit and go to somebody that can guide you in the right way. And then just remember that, you know, especially with implants, like we talked about, things have evolved. You don't need to replace implants every 10 years. You actually can have it followed using ultrasound is a great way to do that. And what we say is, you need to do breast implant checks periodically to make sure the implant's fine. So, every 5 years is probably a good interval based on the current data. And that's a great thing for patients.
Right. Wise words from an amazingly talented breast plastic surgeon. Find an expert that can answer all these questions for you. So, helping you become a better and more informed you. Give us your comments and thoughts, and thank you for subscribing to Rohrich Knows podcast.